So what that is now we know that these are much safer. Women are much happier, and men.
Yeah.
Because it's not just a one size fit all.
Right.
You can't just say, oh, I'm going to be on hormones and then just, bam, bam, let me go to the doctor and get on some hormones. Everybody's individual. It's
Right.
So all that Prempro, Premarin, all that's been pulled off, and people shouldn't be on that medication even today.
The views, opinions, and statements expressed by our guests are solely their own and do not necessarily reflect those of Dr. Jason Littleton or the Concierge Doc podcast. We do not endorse or take responsibility for any statements, claims, or perspectives shared in this content. Viewers are encouraged to conduct their own research and form their own conclusions.
Access to the information and materials contained in this podcast is at your own risk. The information contained is presented for the purpose of educating the consumer on a variety of wellness and healthcare topics. The information. Nothing contained is intended to be instructional for medical diagnosis or treatment. The information contained is compiled from a variety of sources. The information should not be considered complete and exhaustive and should not be in place of a visit or consultation with your own primary care doctor. Welcome to the Concierge Doc podcast. I'm your host, CEO and founder of Littleton Concierge Medicine, Dr. Jason Littleton. Welcome to the podcast. Today, very excited. We have a good friend of mine who's a functional medicine internist with over 30 years of medical experience and founder of a personalized concierge practice on Florida's Emerald Coast and Panama City Beach. She helps busy professionals, midlife adults struggling with fatigue, brain fog, weight gain, joint pain, and other chronic conditions uncover the hidden root causes of their symptoms, whether from hormone chaos, gut dysfunction, or environmental toxins like mold. She's also author of a new book called Smarter, Stronger, Longer, Live Longer, Perform Better, now available on Amazon, where she shares her proactive root cause approach to optimizing health, preventing chronic disease, and extending longevity. She combines advanced diagnostics, personalized hormone optimization, and lifestyle medicine with the time and attention patients rarely find in conventional medicine. Her mission is to help people regain clarity, energy, and youthful vitality so that they can thrive at any age. Welcome to the Concierge Doc podcast, Dr. Myra Reed.
I'm excited to be here. Thank you so much for this invitation.
No, I'm excited. A lot of people have questions about hormones, when they should start, if they should take them, what's safe. And a lot of doctors have questions. A lot of doctors don't know what to do. And you have a new book out that it's going to help not only doctors and patients. I think that is incredible. I am so excited for people to hear about your new book, Smarter, Stronger, Longer, Live Longer, Perform Better. And it's on Amazon, right?
Yes,
there it is.
Hot off the press, just came in. Yes.
I mean, tell us about yourself and then let's jump into that book. But I mean, you're a functional internal medicine doctor. And a lot of people don't know what functional internal medicine is. And not only that, you're a concierge doctor. So tell us a little bit about that.
So I was traditionally trained, grew up, both of my parents were actually physicians. So I know what the old time type of medicine is all about. I attended medical school in Louisiana and then did my internal medicine in Texas. Did a lot of emergency medicine at first, but what I always knew is traditional medicine. And I could see medicine was changing. You know, we could see how insurance was starting to dictate how doctors could work, what they prescribed. All of these things were the way that we were taught and ingrained in how medicine was going. Around 2015, I started seeing how the insurance companies were really forcing doctors to have to see more people every day, and you were having less time. And I knew that's not how I like to practice medicine. So I looked for a way that I could spend more time with my patients because I love to get to know them. And, you know, when you listen to someone, you can really find out what's wrong with them instead of that little quick in and out, just test, and then send people out with a pill or trying to, a short answer for their problem. So in 2015, I started looking for a way such as concierge model where I could spend more time with my patients, which meant I didn't have to see 30 people a day. I could see 6 or 8.
Right. Right.
And yeah, because that was just the way medicine is supposed to be.
Yeah.
People just want a doctor that's going to listen to them.
Yeah, I agree. I mean, in my concierge practice, my rule is 4 a day,
Yeah.
and because if you're a member in my practice, you're a member who all my staff knows. I know
Mhm.
you're meaningful to us, and we're walking this journey with you. And I'm sure that's the exact same in your practice.
Yes, it is. And when you say 4 people a day, I probably see 4 to 5 people a day actually in the office and not only that, they also have access to us after hours. So they get a lot of things answered when they're not even just in for the
Right.
appointment.
So sometimes they don't even have to come in. You're communicating them, with one of your software tools, and they just feel connected. That's huge.
Yes. Like today, I had a patient that, called in really sick. People when they're sick, they don't want to have to go somewhere. They just want to feel better. And what can they do even at home? Or, they don't all just want an antibiotic.
Right.
And right now, a lot of, viruses, flus going around, maybe COVID and such. And that doesn't entail just coming in and get an antibiotic. So we do a lot, and even over the weekend, let's say people were calling and saying, I don't want to go to a walk-in clinic or the emergency room, and I don't want to wait till Monday. Is there something that you can help me with over the weekend? And that's the beauty of this type of practice is you know your patients, you spend time with them to get to know them. Our whole staff knows them. In fact, my nurse a lot of times handles things for me, talks to the patient, and they love her because they know her and they trust her. And she can take care of a lot of things that takes a lot of load off of me as well. And the patients are very happy with that.
I mean,
So this model is great.
yeah, no, I totally agree. And it makes a difference because you're really taking care of the patient. I love what you said at the
Yes.
beginning. If you just listen to the patient, you can figure out what's wrong. And
Yes.
a lot of people aren't listening to their patients. So I, I'm a firm believer in this model, as you are, obviously. And it's making a difference in people's lives. We know that. You and I know that. Now, functional medicine. Now, what is that? A lot of times people don't understand what that is.
People don't. And really, I spent the first many years trying to explain to people what it is. And I think it's going to catch on a little bit more now. We'll see what there's some big things happening coming out in the future about functional medicine. So people need to just hang tight. But at the same time, we're going to explain to what it is getting to the root cause. Instead of that pill for an ill approach, like a patient says, I'm having an issue. In fact, I just finished doing a meet and greet with the patient because that's what I do. I'll meet with them, answer their questions, get to know them even before they become a patient in the practice to make sure that we're both a good fit.
Mm-hmm.
And so she's like, I don't want to just go to another doctor and get antibiotics. I mean, she was on some antibiotics and they're just tearing her up. And so we were sitting there talking about, she goes, the reason why I'm here is I don't want another antibiotic. I want a doctor who's going to sit and listen to me and get to the root cause. So what functional medicine is getting to the root cause of why people have their issue, not just giving that pill for an ill. And it's also having the patient come in and let me get to know everything that's going on around you because I can get at a wider and a deeper, get to a root cause issue instead of sending them to every specialist that come, it's not, they don't have to go to specialists all the time because I will sit there and address a lot of what's going on with them.
Right.
If they have autoimmune or if they're having gut issues or if they're having those hormone problems, or if they're like, I don't really know, I'm going to all these specialists and they can't find out what's wrong with me. I'm going to say, well, let's look and see what the root cause could be. Maybe you're exposed to some toxins.
Mm-hmm. Right. Right. Yeah. No, well said. I mean, I just think that we need to get to the root cause and be more root cause focused to help people instead of just treating the day-to-day issue or the issue of the moment. Getting to the root cause, that should always be the goal of every patient journey. And I just think in conventional medicine, I've been there too. I've been in conventional medicine, just like you have. Uh, that just doesn't happen. There's too many patients, not enough time. I call it conveyor belt medicine. Um, where a person's seeing, like you said, like 30 patients a day, a patient every 15 minutes, a new patient every 30 minutes, while they're doing like 10 callbacks, looking at 17 x-rays and writing 11 prescriptions throughout the day. There's just no time to actually spend with the patient. You only have 15 minutes to spend with that patient and to figure everything out in that sliver of time. Can't do it.
No.
Um, I
But yeah,
mean,
that's when patients come to me, instead of them being on a whole laundry list of medications, I'll sit down and, we'll go through. And my objective is to get them off of medications, but not
mhm,
only keep them out of the hospital. I can't even remember the last time one of my patients has been in the hospital. It's crazy. They're healthier. They are on less medications.
yeah,
They're not going to as many, most of the time, they're not going to as many specialists. And and they all just say, I love the reason why my practice, the patients love it on top of that is like, they're like, well, I go to the GI doctor, I'm going to the pulmonary doctor, I'm going to the allergist, I'm going to all these different specialists, but no one's talking to each other. And they're having, I call it the silos of different specialties.
yeah.
And so saying, well, let me take all of this and I'm going to be like your quarterback.
I love it.
I'm going to this together and I'm going to help. Let's make a plan and I can have that continuity of care that you need. And they want it, but they need it. And we're going to say, do you really, we want to make sure everything's talking to each other. Like they're like, well, do I need to be on this medication? Because I think this medication is causing another side effect. And is this, and they just don't understand and they're confused.
Yeah.
And they don't always need to be on, and maybe a lot of their problems why they're feeling bad is because they're on a medication that doesn't agree with them or it could be interacting with something else that they're on.
Yeah. Well, yeah, exactly. Well said. I mean, taking the time to figure that out, tweet that out, is everything, to having a smooth journey, with our patients. Now I want to get into the book here. I want to talk about hormones and who needs them. Why do we need them? When do we need them? How do we need them? What forms do we need them? What should we know about hormones, and when should we ask about hormone supplementation?
Well, I'm going to say, as we age, we start losing a lot of the things that keep us young and healthy and such. And one of those is hormones. And especially, and it's not just women, I'm talking about for men as well. And I talk about this, but women start going through perimenopause, which means your hormones start changing and you'll start getting the waves up and down of the estrogen and the progesterone and the testosterone changes. And the hormones really control so much in our life, like our mood, our brain, our heart, really everything. And they're all tied together. So hormones are anything from estrogen, testosterone, progesterone, DHEA, but it also entails thyroid and your stress hormone, which is cortisol.
Mm-hmm.
So as we start aging, we start losing these things. That's what causes our chronic diseases to really increase in our body.
Mm-hmm.
And we know now with all the research, I'm going to go back to 25 years ago when the WHI study came out that women were taking off their hormones and everybody got scared. They go, you can't be on hormones. It's causing cancer. Breast cancer is causing stroke, blood clots, all these things. But those hormones back then were the synthetic hormones. Now, synthetic hormones are the ones that are not identical to what our body produces.
Right.
And our body, back then, yes, the synthetic hormones like the estrogen,
right,
made from horse urine.
Yeah.
And then the progesterone was not even a natural. It was called a progestin, which was very inflammatory to the body.
Right.
So all that Prempro, Premarin, all that's been pulled off. And people shouldn't be on that medication even today. But since that time, there's always a silver lining. All the research is coming out. And now we're actually have these bioidentical. What does bioidentical mean?
Yeah.
Well, that means that they have structurally made these hormones from plants, like, that are structurally made from plants,
Yeah.
but they're really chemically related to our bodies natural hormones and receptors. So what that is now we know that these are much safer. Women are much happier, and men.
Yeah.
Because we now have these replacement of the things that we start losing as we age that keeps us viable and healthy and strong and mentally better, emotionally better, because these bioidentical hormones, when it says bioidentical, so like I said, it's identical to what our body would normally produce. Right. And the studies are all showing the safety behind it now.
Yeah.
So why it's such a big thing that people are on. In fact, I was just with with some people this weekend. They're making a big comeback. Tamsin Fidel is a TV person who's just wrote a book, and I was just with her this weekend, and she's really putting a push for people to really start opening their eyes to the safety of hormones. But I can tell you that it will make you smarter. Like my book says, smarter, stronger, longer.
Yeah, yeah.
Because the studies are showing that if you when the hormones aren't replaced,
yeah,
that all-cause mortality, which means death,
mm-hmm.
increases significantly. And if you get on the hormones, it decreases that death rate.
Yeah.
That I'm going to tell you one other really important thing that I was talking a lot about. I'm sorry to but I just have to mention this because I'm kind of on a roll about it. But when women lose estrogen through perimenopause and menopause,
mm-hmm.
that becomes the number one killer of women after menopause is heart disease.
Yeah.
Because of loss of estrogen.
That's major. I mean, that's the information people need to hear. I mean, mm-hmm. people need to hear that so that when they're approaching that time, that they get plugged in and get supplementation as appropriate, if it's appropriate, right? Now, are you finding that people who are receiving bioidentical hormones are feeling more energized into their 60s, 70s, 80s?
Yes. And the studies do show that the best time to get on hormones is within the first 5 years of going through menopause. And so if it's been 10 years or more, then you really need to find someone who's well-versed in studying about these bioidentical hormones, because it's not just a one-size-fit-all.
Right.
You can't just say, oh, I'm going to be on hormones, and then just, wham, bam, let me go to the doctor and get on some hormones. Everybody's individual. So you always want to go to someone who's well-versed in hormones and looks at the safety profile with as you, as a person, and your, right. your lifestyle, your family history, your exposures and all that. But I am going to say that, yes, that getting on hormones earlier is always better. But when I know, even just for me, but I see it in all my patients, when I get people on hormones, they sleep better. And we know how important sleep is.
Yeah.
And that's been a game changer. Sleeping better. You have more energy during the day, which is what we all want.
Right. Yeah.
We know, I worked with Dr. Dale Bredesen, who is the neurologist doing all the study on dementia that's proven to reverse dementia. And one of his number one things for preventing dementia is hormones, these bioidentical hormones.
Yeah, I was getting ready to ask you about that, because I loved what you said when you were saying that, people's memories are better. I figured that you would say something as it relates to dementia. I just think that is really powerful. And obviously, when a person comes to you, I'm sure you're doing lab tests, you're finding out where their baseline is, and making sure they have appropriate screening tests. I think that's one of the things when I institute hormone therapy in my practice. I'm looking at making sure that women have mammograms. They're looking at their family history. For men, making sure that prostate's okay, doing all those things, going through all those checks. What type of screening do you do before you start someone on a bioidentical hormone plan? What does that look like? What's that evaluation? Walk us through that.
Okay. So initially, of course, any patient that comes in, I'm going to do an extensive lab test on everybody if they haven't had one in the last 3 months. But I do my baseline Cleveland Heart Lab is what I like to use with all inflammatory markers and such. But I always will talk to people and see, okay, let's go ahead and do some hormone testing as well. Not everybody wants hormones, and I'm not going to push hormones on everybody, but like I said, everybody's different, and I like to meet the patient where they are and what they're interested in. But I will do estradiol level, I'll do testosterone, and in men, I'll do a total and a free testosterone as well. I do DHEA, and I'm kind of mentioning a few of the things. I occasionally, if people have a history of breast cancer in their family or in themselves, or even men who I'm worried about prostate cancer, I'll even do an estrone, which is a different type of estrogen, because there's 3 different type of estrogens that we measure and that we work with. But I will do thyroid panels, cortisol, like with their early morning cortisol. I'll start with those in a blood test. Then I'll talk to them about different hormones that I'll give them different options, because there's so many different ways you can take hormones, and we can talk about all that, and such. But once they're on the hormone replacement, depending on how they're taking their hormones, depends on whether it's going to be just blood test, or if it's going to be blood or urine test, or even saliva test.
Mm-hmm.
The saliva is, mouth,
Right.
which is really good for checking the cortisols. Like if you want to see someone's cortisols throughout the day, the saliva is really good for that. But if men also, like not just men, both, replacement is real important. And I'll go through with patients and ask them, okay, here's your different options. You can do like estrogen can come in a patch. There's also creams. Progesterone is really good in the oral form or the pill form at night for people to sleep, because it releases these metabolites that help the brain relax. Mm-hmm. But one of my favorites that I like to use, and there's some other ones that we can offer as well, but one of my favorites is a hormone pellet.
Yeah.
And I do that. A lot of my men really love that, because I can give them like 2,000 milligrams of testosterone in pellets, and it'll release over a 6-month period of time. And it's a slower release. And the good thing about pellets for men and women is that it bypasses the liver.
Yeah.
So you don't have that risk of blood clots.
Yeah, no, that's, I was getting ready to ask you about if you do pellets, because obviously that is something that can be very convenient for people, where they don't have to take a pill every day or a shot, and that can make a huge difference. And I think it's actually a great option, especially if you don't want to think about taking your hormone medication, routinely. Once you get the pellet, you can go on with your life until you need it again. That's awesome that you do that. And you talk about all of this in the book.
Yes, I believe so. I'm actually also looking to make a hormone online course just for people for information. But in my book, I do talk about hormone replacement. I'm not really explaining in detail about the hormones, because, in the book, it's more about transformations that I do on patients in so many different things, hormones and gut and toxicities and lifestyle changes, sleep. So I go into a lot of these type of things in my book about how to do transformations individually in different people. But I do talk about my hormones, and I am going to say everybody has a different preference of hormone replacement. Like for me, the thing that worked the best for me is a hormone pellet. Mm-hmm. And it can always tell when I'm ready for my hormone pellet, because my sleep starts getting disruptive. My muscle mass will start going down. My skin gets more dry. And I just my mood is just not as good. So my preference for me, instead of doing a patch or a cream or a Trochet or different things like that, is a pellet. And so I know there's a lot of people out there that are doing hormone replacement. And I really want to advise people to really reach out and find someone who has taken a course on the different ways, because hormones are individualized is the bottom line. And so it's not a one size fit all. And everybody responds differently genetically and such as well. But I always say, going back to saying the blood test and the testing, I always tell women to always get an annual mammogram for sure, and do monthly self breast exams. And and I'm going to say this, that hormones are not, I know there are hormone positive cancers, but we know that like breast cancer and prostate cancer is not coming from hormones as much as it's coming from toxicities in our environment. And the hormones are not the driver of cancer. And everybody needs to understand that, we do want to monitor and make sure that you don't have cancer starting or that you have cancer before you do anything. But that's just practicing good medicine.
With my patients, before I do any type of hormone therapy or treatment, for the men, as I was mentioning earlier, I'm always doing prostate screening, making sure that's not an issue at all. Breast cancer screening in women, making sure that's not an issue at all, making sure that GYN checks are up to date. That's just the bread and butter how I practice. And I think that's good medicine. And obviously, you do the same. And I want people to feel confident and comfortable. And I want to make it, we want to make a big difference in how they feel and in their lives. And what you said about toxins was, I was about to ask you that because in your book, you addressed that about mold toxins and other hidden environmental exposures. And, just go into that a little bit more. How big of a role do toxins really play in chronic illness?
It's huge. If I could say it's one of the number one drivers in our world that is causing chronic disease and cancer and dementia and Parkinson's, all the neurologic, it's definitely toxins. When I was growing up, in the 70s, we did not see people with autism. Very rarely, kids weren't thrown on Adderall or, for ADHD and such. But I don't remember anybody with autism. And now it's become an epidemic or of kids. Now schools are filled with special needs classes. And if you can see how it's just escalated. And one of the things that I do in some of my lectures is I talk about how Parkinson's and autism are all running, going this way instead of steadily across. It's really escalating up. And what we found out is that glyphosate, which is Roundup, which is the weed killer that they use on wheat before it's harvested. And wheat is what's making all of our bread, and everybody's eating more bread, especially fast food and processed foods.
Right.
Additives and more preservatives and all these other things. You're adding all these chemicals in our food. That's what's causing the cancer and the chronic illness and all these neurologic problems.
We can talk an hour on this stuff. That's a huge problem.
Yes.
That's what's setting people back. That's what's setting them up, for cancer and chronic illness. I think that's why people feel tired and foggy, and you talk about this in your book,
I do.
And and it's a great segue because I was going to ask you, what can people do right now? 2 or 3 things that people could do right now if they are feeling tired, foggy, or they're just not feeling themselves. What do you do? Obviously, eliminate toxins has got to be one of them. I get that. But what can people do right now?
So basically, one of the first things I'm going to tell people is to filter your water, get a reverse osmosis under your sink. You can get them off of Amazon and or even get the counter, not just the Brita and all that. You need a reverse osmosis system to get all of the chemicals out. And then you can add some minerals back, some safe minerals back. But I always say clean air, clean water, and clean food, and clean body products.
Yeah.
So there's a lot. We're getting it at all angles now, but filtering your water, eating the organic foods, get as organic as you can. Now, I'm going to say this: not everything has to be organic. You can look online and search or Google it. The Dirty Dozen, and it's more than just a dozen foods, but those will tell you the foods for sure that you need to eat organic.
Mm-hmm.
The Clean 15 ones are the ones you don't have to buy organic. Okay, so there's a difference. And you can go to the EWG.org, which is the Environmental Working Group.org, and they have all the list of things. And there's even apps now that you can get on your phone, like Yuka, Yuka.
Right, yeah.
Things like you can scan foods and products and such. But we have to start you really need to take educate and learn. And people are doing that now. So, avoiding as many toxins. I mean, don't eat fast food. Don't eat processed food.
Right. Yeah.
Go,
Well,
cook at home, or if you're going to eat out, find the restaurants that are really.
people need to take that message to heart, because that's been said and we've heard this before. But you're right. Don't eat fast food. People really, if they want change, they have to take it to heart. You have to take
Yeah.
you have to take health responsibility.
Yes, I mean that, and it takes a little bit of effort, but once you start doing it, just do some baby steps and start adding some new things. And then once you start doing these things, it does get better. But one of the things I do want to go into something real quick about when you were talking about toxins and we were talking about environmental toxins and talking about the foods and such. But one of my things, unfortunately, that I got pushed into learning about and became somewhat of a niche of mine is mold toxicity. And I know a lot of people really don't want to hear about it or talk about it. And I try to avoid it as much as I can as well. But one of the things when people come in and they're having brain fog and fatigue, and it may not just be replacing hormones. I mean, yes, you can look at doing that. But if you're still having problems with that, one of the things is making sure that you haven't had a water damage. And it could be a small leak in the house that is causing water damage, molds to grow in your home. That wreaks havoc on our brain and our body. And it's so hidden and people don't know to look for it. And that's one of my expertises, is finding out about if this could be a problem wreaking havoc on you. Because if you can't find the answer and you're still feeling bad, then and finding doctors who are specialized, like functional internal medicine, functional integrative doctors who are specialized in mold, or there are people out there, and there are some places that people can look. So if people are interested and they want to, they can reach out to me and I can help direct them in the right direction for that. If you are concerned about having some mold exposure that could be even colonized in your body from years ago, you don't have to necessarily still be living in it. There's just some things, and that is a whole nother episode of things. But I did want to mention that because,
yeah, I'm glad you did. That needed to be said. Yeah, everyone I have on this podcast, I talk to them about my meds protocol, move, eat, drink, sleep, and I always ask them, what do they do personally to live a great life and to have optimal health. In the book that I wrote in 2012, Energize Again, I introduced this principle. So I want to ask you, for my listeners, how do you move, eat, drink, sleep? Start with the exercise part, or move. How do you move? What do you do? What does Dr. Myra Reed do to stay optimum in health?
Well, I'm always optimizing my health. So I love to practice what I preach. I get up at 5:15 in the morning and I go to the gym. I have a group that I work out. We have a trainer that we do strength training 5 days a week. I like to do cardio as well. I have an elliptical at my home that I can look out the window, at nature. I can put a podcast on or whatever and get a good hour of
Concierge
elliptical.
Podcast is probably the most healthiest way you can go when you are on your elliptical.
It's a good one. That's a good one.
It just had to be said.
Yeah, no, that's great. Listen to podcasts, different things such as that. And then I love walking outside. I love being out in nature for just, mental part and exercise as well. That's huge. Being out in nature is a big love of mine. And as far as I prioritize sleep. That, to me, I call it precious sleep. And I have an Aura ring that I've had for since before they even came out. I was in their beta group with it. And I always get new ones and stay on top of my sleep. And first thing in the morning, I get up and I look to see what my sleep score, my readiness and such is. And then the other thing is, like I said, I, filter my water and bring that to work with me. Then I shop food that is going to be clean, cook at home a lot. We do eat out, but when we do eat out, I like to go to places like farm to table type restaurants and that are getting wild caught or, farm raised produce or proteins, and eat a lot of dark leafy greens, eat my vegetables. And let's see what else. So I trying to do all those clean things. So those are I follow a lot of my lifestyle recommendations. That's what, I want other people to do. So I live it.
I love it. I mean, I love it. I love how you move, eat, drink, sleep. I think, when I have guests like yourself on and people get a chance to hear what are the unique things that my guests do as far as their health, there's a lot that people can extrapolate from that and that they can see if that works for them or not. I always tell people talk with your doctor, of course, make sure it harmonizes with your health, your labs, everything like that. But that's awesome. I love the tips that you gave. I love the tips that you gave and the snippets that you gave about your book, Smarter, Stronger, Longer. I can't wait for my audience to read it. They need to order this book. Where can they get it?
Amazon has it. So you could get it in Kindle, hard copy, or paperback. And yeah, that's real easy. I mean, you get it within a few days from Amazon. Everybody was just ordering. I just literally came out last week and everybody's sending me messages that they're already getting their book. And I'm going to say one other thing. If people want a really quick, easy 7-day meal plan, they can go to my website, drmyrareed.com, and download the free 7-day meal plan. And that pretty much tells people like what I eat. And it makes it easy.
Oh,
and
awesome.
so,
Awesome.
a good thing. And if you want to take a hormone quiz, I have different little quizzes on my website too that people can take real easy and just download a few things.
Oh, I love it. And that's what I was going to ask you. Where can people find you? And I'm sure they can find you on your website, but can people, if they want to do a consultation, do, a telehealth with you, or do they have to come into the clinic and be seen? How do you manage that?
So I love seeing people in person and I love that connection, but also do telemedicine as well. So we have like, if people wanted to work one-on-one with me, they can go and set up a Calendly link to set up a meet and greet as well. And like I said, look for my online courses, but I'm always putting things out on YouTube. I have a new YouTube channel that I'm starting to load a lot of more content regularly on. So if people want to follow a lot of good, just healthy tips. And I have a Q&A that is free right now for people to join on September the 30th, which is going to be at, I believe, I can't remember if it's 5:30 or 6 Central. I'm in Central Time. I know you're in Eastern, but I will have a live Q&A on September the 30th that people can, if they want to ask questions, they're welcome to join live.
Okay, awesome. Yeah, you guys.
And I have Instagram and Facebook as well. I keep that very active as well.
I love it. I love it. Listen, thank you for coming on today. I mean, I've learned a lot. I know my audience have learned a lot, and I know a lot of people are going to reach out and contact you. I mean, that's amazing. Thank you so much for coming on. I think that I think people need to run and get your book. I think if you're feeling foggy, you're tired, you're just not feeling optimized, you need to get her book. You need to learn about hormones. You need to reach out. You need to contact her. I think it's so important. And in these days, as we age, our body's always changing. It's not static. So you have to make sure that you're paying attention to your body, listening to your body, checking your labs, talk with your doctor about getting your hormones checked, get her book. All these things can make a difference. Again, I love having guests like Dr. Myra Reed on the show. I thank you guys for listening as you always tune in. And remember to download this podcast, Apple, Amazon, Spotify, and to follow me on Instagram, Facebook, and LinkedIn. Thank you for spending time with me today. We will talk to you later.